Welcome, everyone, to another episode of Arthritis at Home. I'm Kelly Lendvoy from Arthritis Consumer Experts, and today we're looking at lupus, which affects 1 in 1,000 Canadians. And while there's no known cure for lupus, system control and maximizing quality of life are keys to living well with lupus. To learn more about the lived experience from people with lupus, this week, ACE, together with Lupus Canada, has launched a national survey on lupus. And today we're joined by Leanne Mielczarek, who's Lupus Canada's CEO, to talk about the Lupus National Survey. Leanne, welcome.
Thanks, Kelly. It's great to be here.
Great to see you again. Lupus Canada obviously is a good friend of ours, and we enjoy our collaboration with you, and we're really excited about this initiative. Maybe just to get us started, Leanne, for people who might not be familiar with the disease, can you tell us a little bit more about lupus?
Yeah, absolutely. So, lupus is a disease that when your own body immune system, or where your own body immune system attacks its own tissues and organs, and how it can affect one person can be quite different as to how it affects another person. So, you may have heard the phrase of a disease of a thousand faces. That is coined off of how it affects everybody so differently. And it can range from where you can see someone that is not able to get out of bed from the severity of the symptoms to someone who has a productive and work life, but they can also go into flares and they have to manage those flares. And those will be some of the things that we're learning a little bit more about as we go along.
So that's interesting, and I think that last point lends itself to another question and why this national survey on lupus is so important right now for the lupus community.
hmm hmm Yeah, definitely. So from the survey, we're really hoping that it will help yourselves, ACE and Lupus Canada, to identify where the lupus treatments and healthcare are meeting the needs of people living with lupus and where those gaps exist.
And I think to help us sort of um, understand that experience of patients and to uncover maybe some of these gaps, we've looked at several important topics in the survey. Maybe you can just walk us through some of these topics that we're asking people to respond and give us their experience of and why they're so important.
Yes, it really is. We've said how important the survey is, and really we really want to emphasize that because the patient voice is just so important, especially in this lupus space, because it is a serious disease, but it's often invisible. So we do need better data to show the real impact on Canadians living with this disease. Given that it's misunderstood, that affect how it affects everybody in very different ways. It's very hard for the general public to understand what lupus is, let alone someone who's been newly diagnosed. It can have serious impact. And does not have the same level of visibility, research, or public awareness as many other chronic diseases. The lack of recognition translates into limited data about how Canadians are actually experiencing lupus, whether it's in terms of diagnosis, so length to time in which they were diagnosed. We see on average it can be up to 7 years, access to care, treatment effectiveness, or even the day-to-day challenges of living with this disease. And when we talk about uh, treatment effectiveness, we also talk about equity of care to ensure that all Canadians have accessibility to treatments. So some of the areas we want to learn more about is about that length diagnosis and what did that look like for folks, the treatment and care, their daily lives. Also, the mental health and emotional well-being are very, very important when it comes to someone living with lupus, because leading up to that diagnosis, many folks may hear about that. Some doctors may have say, well, I think it's in your head, because it's hard to diagnose lupus. There's not one particular test that is a conclusive one to say, yes, you have lupus. So it can be quite the journey, and that can really impact the mental health and emotional well-being. And even caregivers' impact of helping someone while they're sort of going through this journey and then once diagnosed. So we really want to hear from the lupus patient as to what their experiences have been as they've been on this journey to diagnosis and through their journey living with this disease.
And I think it's what's interesting too, Leanne, and maybe you can just describe a little bit when you're referring to treatment. Um, for a long time, there have been not a lot of options, treatment options for lupus patients. We've seen a tremendous, over the last decade, certainly a tremendous amount of research and innovation around the disease, and we're starting to see the results of that with new treatments. So that that world of advanced therapies is evolving quickly now for lupus patients.
Yeah, absolutely. We back in 2011 was the first time we saw a specific biologic for those living with lupus, which was a wonderful. It was so fantastic time in the lupus space. However, not everybody had access to that. So we really need to speak with the right folks to make sure that everybody has access. Since that time, about maybe 15 years later, we've seen another biologic. And, I always like to quote someone that once said this to me about where we are in the lupus space, but there's a bit of a tsunami of new medications coming through the pipeline that we're extremely excited about. It gives people such hope who are living with this disease, but we need to be able to get those into the hands of those living with this disease. So it's wonderful that there's new research taking place. There's a lot of hope in this space, but until it reaches the patient, we have a lot of work to do to ensure that there's that equity in treatments.
So the survey is the person with lupus's chance to help shape that future that you're describing. So we're really excited and hoping to get as many people participating as possible. At
Mhm.
the end of this episode, we're going to provide a link where people can connect directly to the survey and participate. It takes about 15 minutes to complete. We really, really hope people uh, take the survey and help us build as rich a picture as possible that we can share with important audiences. A reminder that all the responses are kept anonymous and are stored in a secure database. And really important that we hear from as many people as possible. Once we get the findings, Leanne, ACE and Lupus Canada are going to work together to analyze the data and then to share that information. What are some of those plans? What's included with some of those plans?
Yeah, it's first I'd like to say, it's really important that everybody participate. It is anonymous and it won't take very much of your time, but we really need that patient voice. That lets us at Lupus Canada and ACE be able to work together to inform our research priorities and guide our advocacy for better care and support. So once we get the survey results, we will be able to analyze that and make sure that we are going in the right direction to better support the lupus patient.
Those results will be shared with researchers across Canada, rheumatologists, uh, government officials from ministries and departments of health, public and private drug plan managers and decision makers, and the public and the media as well. So really hoping to understanding, raising the awareness and understanding of what it is like to be living with lupus today in
Mhm.
Canada. And once again, your participation is greatly appreciated, and we look forward to seeing that data as it comes in. Leanne, thank you so much for joining us today. And again, we always look forward to working with you and this collaboration in particular. We're really excited about. So, more to come from ACE and Lupus Canada. And if you're watching or listening to this episode, please take the 15 minutes to share your story so we can amplify your voice and improve lupus care across the country. Leanne, thanks again.
Thanks, Kelly. Really appreciate the time.
And thank everyone watching and listening today. Look forward to seeing you on another episode of Arthritis at Home. Bye for now.